I show up every day because I don't know who's going to call me or who's going to show up that needs help. And that excites me, that I'm going to be able to help someone every day.
I've always put myself in my patient's shoes, and I think that's something that as healthcare workers we need to do.
This person could be your mom, this could be your dad.
Going that extra step and doing something for a patient that they probably didn't expect.
This is Montgomery. Patient had a court-appointed guardian. Asked me if I would take the dog and keep him, and I said yes.
We all come together for the patient's well-being, and it's really, really evident.
That's actually probably one of the most rewarding parts about my job, is being able to help the families and the patients, even at the end of that journey.
We provide great care, both emotionally and physically.
For them, this is scary. And they need somebody that is willing to sit and listen to them, was willing to pay them that extra attention. You know, that's our job. We're here to help you.
Sometimes it just takes a second to grab their hand and tell them it's going to be okay.
She just wasn't herself one day, and she was going into septic shock.
I called Lori, and she came right in and took her pulse, and she said, "We got to get her to the ER right away."
Took her to the emergency room, and she ended up being care flighted out.
Lori holds a special place in my heart because I'm here talking to you right now because of her.
And if Lori hadn't have been right there at that particular moment, they said if she hadn't been in the hospital, they couldn't have saved her. Another 5 minutes and it would have been too late. And that's what the doctors had been telling us. Those extra few minutes is what saved her life that day.
It really helps me to feel grateful every day, and it makes you appreciate the things that you do have.
We got to know each other. I held her hands. It was pretty scary while the nurses got her medicine to help calm her anxiety. But I think the most special part is when I walked her husband outside that evening, it was pretty late at night when he left, probably close to midnight. He stopped me in the parking lot right out here and just thanked me for being there with his wife. And at that moment I realized it's hard for the husband to leave a wife when they feel like they're gonna die. And they're unsure of what's gonna happen in their disease state. And it was like looking into his eyes, I knew he trusted me with his wife.
It's a team effort that we all come together here and try to get the patient taken care of.
We're a team that our aim and goal is to make a person feel better and go home feeling better, not just because of the medication.
He took a gentleman's dog out for the walk while he was in the ER room because his dog was in the car. And it was stressing the man that nobody was out taking care of his dog, and so he took the time to go and take him for a walk and got him water and let him know and gave the man the update. And it put him at ease. It helped him relax a little bit to seek his treatment better.
When you work in healthcare, you don't realize how many people this is their family. They're either estranged from the family or they just don't have other family. This is their concern. Who's going to take care of their child, their family? And I hope he realizes that we took care of it.
There was a patient I had, she actually just turned 99 years old. She was a widow and she lived in assisted living, and her daughter would come pick her up from time to time to run errands, and she had a very large bill with us. She wasn't sure how to go about breaching her insurance and other ways to receive the funds to be reimbursed for it. And so I took the extra time to sit down with her, contact the offices that we needed to get the appropriate information from, and she was able to not only come take care of her bills with us, but able to pay other things in her own personal life. And she came back a week later and gave me a nice little thank you card, and I still see her at the store from time to time, and she'll say hi and thank me still. So it's kind of nice to have little impacts like that.
We all work as a team there, and that's huge. That's really huge, because I worked in other facilities and it's not like that.
Multiple patients that have reminded me of family members, and it makes you take a step back and go, okay, this isn't just another person. This could be, what if your mom was in this situation or your dad? You would want somebody to give them the best care possible and to treat them like that was your mom or dad or somebody you were related to.
We're a community hospital, and it's not just taking care of the patient, it's taking care of, hopefully their spiritual needs, and it goes beyond just being a patient at the hospital.
That is probably the most heart-wrenching part of the job, is you do get really attached to the patients and their families. And sometimes when you have to say goodbye, you know, that's heartbreaking.
The whole team here, it's not one person. It's the entire hospital. I haven't run into anybody in this hospital that I didn't like. They go above and beyond what they are required to do.
The biggest thing is that everybody has that same mentality, is to make sure the patients get the best care possible.
I mean, we don't want people to have a crisis or an emergency, but if you do, we would love to be the ones to take care of you.
You know, you're there to help them, and that's a great honor. You know, so no matter what else you do in the end, you just have to realize that this job is an honor.